We begin with breaking news in Ontario. The province has hit a grim new milestone in the fight against COVID-19, the highest number of new infections since the start of the pandemic. Ontario is reporting 1,042 new cases. It is the first time that the province has reported 4 digits in a single day in terms of increase, and the second day in a row where we've seen a record number of infections. Canada saw a record high of COVID-19 cases this week, and Ontario is reporting more today. The growing number of active cases could overwhelm our healthcare system very soon. And to talk more about this surge, we're bringing in our regular segment with Dr. Isaac Bogoch. He's an infectious disease specialist and is based in Toronto. Hello, Dr. Bogoch. Nice to see you.
Good morning. Good to see you as well.
Dr. Bogoch, let's begin with this breaking news of more than 1,000 cases being recorded in Ontario for the first time ever. What's your reaction?
It's clearly an unfortunate number to see, and that's not a milestone that anyone wanted to reach. Having said that, I like to take a step back and look at the bigger picture, the 7-day averages. Even when we look at the 7-day averages, and we also put these numbers in the appropriate context as well of appreciating that there are some limitations to diagnostic testing, it doesn't paint the best picture. We're still moving in the wrong direction. Now, is this related to spike from Thanksgiving that was a couple of weeks ago? Is this all going to plateau this week because the big public health measures were implemented a couple of weeks ago, and it takes a significant amount of time before we start to even see the earliest indicators of success? I quite frankly am not entirely sure, and I think the next week is going to be very telling.
Okay, it's interesting that you bring up Thanksgiving, and if you'll permit me, Dr. Bogoch, we just received a statement from the Minister of Health, from a spokesperson, indicating, and I'll just read this for folks at home, in response to the evidence, our government recently took decisive action to move York, Ottawa, Peel, and Toronto public health regions into modified stage 2. It takes approximately 2 weeks for public health measures to show their full impact on the rates of COVID-19 transmission and other key criteria in these communities. We continue to monitor the situation closely in the coming days. But they go on to say, while today's data is concerning, the increase in cases may be the result of Thanksgiving gatherings, just as you had mentioned, Dr. Bogoch. We continue to urge all Ontarians to do their part, don't let your guard down, and all that good stuff. Work together to keep us safe. So is it that? Do you think in a couple of days the numbers go back down? What do we make of this?
Yeah, it's really hard to know. It's hard to know for a couple of reasons. One is that we're looking at a single point in time with this case count over 1,000. But if we look at the trend over time, it still is going up. And quite frankly, I don't think anyone really has a crystal ball. Like it's very challenging to know what direction it's going to take. There may, a keyword may be very, very early indicators that in fact things may, again, keyword may, start to improve, right? If we look at various age groups and the percentage of tests that are positive in various age groups, there might be a shred of evidence that things may start to be improving. But again, it's really too soon to tell. There's other early evidence from Ottawa, for example, where they're publicizing their data from wastewater, and they're showing that the burden of COVID-19 in wastewater is starting to actually decline 2 weeks after these public health measures were implemented. And again, is this valid? I honestly don't know. I think, quite frankly, the numbers of cases is concerning. But if we dig deeper, are we going to see any signs that this is going to plateau and actually start to go down in the week and weeks ahead? Maybe. It's just not clear. I think at the end of the day, we have to sort of take a step back and think about how does this change any of our behavior? And quite frankly, it shouldn't. We should be staying close to home, not socializing with others, avoiding crowds, putting on masks when we go in indoor settings, washing our hands. And, obviously there's collective responsibility, but those are things that people can do to protect themselves and those around them. And that doesn't change regardless of what the numbers are.
Okay, let's talk about some measures that governments are taking. Starting in Alberta, they're rolling out this new COVID-19 testing system, specifically at airports, and it could mean shorter isolation periods for people who are coming into Canada, particularly Canadians who are returning home. What do you make of this new process that they're going to try?
I love this. This is a pilot project, so I think it's important to recognize that this is not going to be widespread and used across the board, but it's a pilot project. It's done in Calgary. We're at the border crossing from Montana into Alberta. It's completely voluntary. People can choose to either quarantine for 14 days or choose to participate in this. But when you land in Calgary, for example, you get access to a test. If that test is negative, you've got to lay low for looks like 6 to 7 days, and then you can get another test between day 6 and 7. If that test is negative, you're free to go, and you don't need to quarantine for the whole 14 days. Now, again, I think people are going to be watching this like a hawk, and if there are cases and chains of transmission that result from this, you can be pretty sure that they're not going to expand this. But if this is successful, and this is something that can facilitate travel and shorten the duration of that 14-day quarantine period, I think that can be extremely helpful for Canadians, and it might be helpful from an economic standpoint as well. So I think this is a great thing to look at, and I really hope this pilot project is successful.
Okay, let's get to some viewer questions. We have a question from Sanjeev, and he's wondering, how long does the virus survive or last on surfaces? Is it safe to visit someone's house after they have recovered from the virus?
So in general, the virus can be viable for a couple of days on a surface. Now, of course, there's lots of different factors here: humidity, heat, ultraviolet rays. But at the end of the day, if we wash our hands, if we wipe off high contact surfaces, we're doing the right thing. So, but the question is interesting, because you actually probably shouldn't be going into other people's homes. We should be avoiding that. Now, there's obviously a million different scenarios that can occur. Maybe this is an essential caregiver who's going in to help somebody out. But in general, we shouldn't be going to other people's homes. If you are, wash your hands, put on a mask, and wipe off those high contact surfaces.
Okay, the next question comes from Sue Key. Is it advisable to play pickleball indoors at a recreation center? 3 courts are open with 12 players at any given time.
I've got to look up what pickleball is for starters. But having said that, I'd be careful with that, right? This is an indoor setting. I mean, we should really, depending on where you are in the country, there's going to be different public health measures. Where I'm sitting, this would certainly be discouraged, because you're getting together with other people that aren't in your family unit in an indoor environment. So if you're in Toronto, that probably would be discouraged. But if you're in other parts of the country where that's okay, you can probably do it safely. Again, you just have to listen to your local public health guidelines of what those are. But if you put on masks, if you're separated by 2 meters, and you can figure out a way to do this with masks and physical isolation or physical separation and good hand hygiene, sure, why not? But in all fairness, I'm not going to pretend to be a pickleball expert here.
Well, I am now, because I just looked it up.
Oh, good. What is it?
Okay, pickleball is a paddleball sport that combines elements of badminton, table tennis, and tennis. 2 or 4 players use solid paddles made of wood or composite materials to hit a perforated polymer ball, much like a wiffle ball, with 2640 round holes over a net. So basically a glorified fancy-sounding or not so fancy sounding badminton. Anyway, so now we know, and we're experts.
I hear that, and all I can think of is this would result in tears in my household for a variety of reasons.
Okay, well, we don't want that, so no pickleball at your place. One more question from a viewer. This one comes from S. Varavia, and they're asking, they live in a high-rise building where the HVAC system is shared, and they're wondering if the virus can be transmitted through the ventilation system, and do we have to take extra precautions in winters with the heat running through those vents?
So in general, I think there's a couple of important points here. One is that we know air circulation and ventilation of units is extremely important, but there haven't been outbreaks of this infection from individual unit to other individual units related to the virus to date that have been significant, at least here in Canada. Now, if we rewind time and look back 17 years ago, there was actually a pretty well-known outbreak of SARS I think it was in Hong Kong, related to something like this. But we haven't seen that, for example, with this infection. Oh, we got a neighbor. Hi, I'm on live TV. Oh, it looks like we have pickleball. Here we go. Here's my wife.
You guys have pickleball?
Apparently we do.
You didn't know?
There we go.
I guess you're not like the lead player in the house.
No, I've never seen these before in my life. But good to know.
Okay.
Looks like I know what I'm doing this afternoon.
Sorry. You were saying?
Yeah, so SARS, for example, was transmitted in that manner in a very well-known outbreak. But we haven't really seen that in Canada. We haven't seen that in Canada with COVID-19 just yet. So I wouldn't be too concerned about that, to be fair.
Dr. Bogoch, I didn't hear anything you just said, because all I can, it's like that, remember that kid that walked in on the dad on BBC in Korea, and she straddled in, and he was like, "Thank goodness you didn't push your wife." I'm sorry, I'm assuming that's your wife. You didn't push her.
Yeah. No, I love her. She's wonderful. It's great. I'm glad I knew what pickleball is. I'm a little surprised. I'm just as surprised as you are. I didn't expect her to come in with pickleball rackets, but again, looks like we're playing pickleball this afternoon.
Yeah, have a nice afternoon, and thanks for your time, Dr. Bogoch.
Take care. Have a good one.
Dr. Isaac Bogoch is an infectious diseases specialist and apparently a pickleball enthusiast. He's based at the Toronto General Hospital.